So I wanted to start off by inviting each of you, for those people in the audience who have not heard their stories or read their books, I wanted to just give you each 5 minutes to sort of describe the story and your experience, and then we'll jump into some questions. We're going to save the last 15 minutes for audience questions, and we'll be going around with a microphone to take those. So if you could hold those for the end, and then we'll open that up. But Mona, did you want to start?
Sure. I first want to say thank you. Thank you for that kind introduction. Thank you, Sanat, for inviting us. Thank you to all of you for being here, and thank you for the work that you do for our patients and our communities. So my story is about using science, about using research to uncover one of the most kind of emblematic environmental and public health injustices of our time. So Flint, any Flintstones here? Anybody from Flint? No? Oh, there's some, oh yay, there's always Flintstones. Okay, so I know there's some non-Michigan people here, so I'll try to be brief on my story. I'm not going to cut into your time. Okay, so Michigan, right? So we're the Mitten State. So what are we surrounded by? Water, right? And Flint's just like we're about an hour less east of here, like right around, almost in the middle of our mitten. And for half a century, we were getting our water from the Great Lakes, like many communities in Michigan. But in 2014, under this kind of usurped state of democracy, we were under emergency management. The state took over the city, just like they took over the control of many of our majority-minority cities in Michigan. The state changed our water from the Great Lakes, which is awesome, high-quality water, which was treated in Detroit, to the Flint River without proper treatment. It turned out to be super corrosive. They did not add a really important ingredient to treat the water, which made it about 20 times more corrosive than the water that we got from the Great Lakes. And that corrosive water corroded our pipes and our plumbing, our water infrastructure, which is predominantly lead-based, and not just in Flint, but really kind of throughout our nation. That lead came out of the water into the tap and ultimately into the bodies of our children. So as a practicing pediatrician in Flint, heard about this, and nothing was happening. And I knew that if I was going to protect my kids, my patients, I would need data. I would need science. I would need research. And that's what kind of compelled me to do the research into the children, into their blood lead levels, and went through all the necessary protections, which I'm sure we'll talk about, but went through IRB, which usually takes forever, but didn't in this story, and saw that the kids' lead levels were elevated and shared that research very publicly. So that is, in a nutshell, kind of my story of, once again, using science, using research, working with IRB very closely, to protect the patients in my community.
So I started my career before I entered the academy doing direct service, director of practice, helping families who are facing eviction or utilities shut off try to stay in their homes or keep their utilities on. And I just remember this moment of thinking, this is a cycle. A lot of people talk about the cycle of poverty, and they're often talking about sort of families and culture, but the real cycle is one of society, where you can just count on a certain number of families falling behind on their rent or falling behind on their utilities. And how can it really be the fault of families if that happens every single month? So I decided I wanted to do policy relevant research and see if I could be a part of solutions that would help break that cycle of poverty. So I came back and discovered my inner data nerd. So I love charts and spreadsheets. They make me feel warm and cuddly inside. So maybe some of you have a similar feeling. And I was a really easy, researcher for the IRB. I mainly use secondary data for all of my research. So a lot of it was given blanket exemption, so I didn't cause anyone any trouble. But then
totally boring research.
Totally boring. But then for my first book, $2 a Day, which examined the decline of the cash safety net and the rise of families who were just surviving. They might have food assistance, but they didn't have any money. And what does it mean not to have money in the United States in the 21st century? I partnered with Kathy Eden, and we combined these different kinds of research where we looked at big data, but we also got to know families and learned all of those questions that we didn't even know to ask, all the things that weren't on our radar that impacted their lives. So out of that, we wanted to have some policy impact. So a bunch of us got together and said, we need a more stable cash safety net for families. And it turns out countries all over the world have done exactly that. It's called the child allowance or a child benefit. And it starts with this simple logic that raising kids is expensive. And society has a reason to come alongside parents in that work. So we wrote a paper that said, hey, let's convert our child tax credit that doesn't really do that into a fully refundable, you all like the wonky words, so I'll use them, a fully refundable monthly cash tax credit. And in 2021, we did that, where for a very brief amount of time, families got $250 per month per kid, $300 for little kids. And we saw child poverty plummet, and we saw food insecurity plummet. So when we wrote that paper, we sent it out for review. There was one professor who wrote back, anonymous reviewers, as you all know, that said, I guess it's fine for Professor Shaefer and his colleagues to talk about things that can never actually happen in the United States. So they happened in 2021. So that professor, I would say things to that I can't say in front of polite company like you. And it didn't become law of the land, but I think it proved what's possible in the United States and that more is possible, and that it can be driven by research, ethically based research.
Thanks so much. So the next thing we wanted to talk about is gaining the trust of communities. And I know, for one, as a researcher at the University of Michigan, I had never worked with the Flint community. And I remember hearing after the Flint water crisis about the Flint community feeling like all of these researchers were suddenly descending into their community, and it felt sort of predatory. And so I was curious if you could speak a little bit about how gaining the trust of the Flint community and any advice you have.
Yeah, this is a huge question. For several years after the water crisis became a national story, I literally felt like I had my arms atop the children of Flint because so many folks wanted to come in and research. Well-intentioned folks. Some university, I think in Texas, like, we want to come in and do liver biopsies. I'm like, go away. My own university, like, we want to bring in mobile EEGs, and I'm like, go away. So there was this very much of a feeling of a predatory feeling. Sometimes I think we call them piranhas that wanted to come in and by and large probably do good. But they could smell the research grant dollars, and they could smell the opportunity to do something. And that's not what we needed. And that's not what we were ready for. Flint, the water crisis severed that trust between government and institutions and the people and the residents of the city. But that contract, that social contract, was on really shaky ground even before then, because Flint, like so many of our communities, has suffered from decades of lost trust and neglect and disinvestment and systemic racism. And then the water crisis was just another episode that shattered that trust. And it was a city that was used to academics coming in with a grant, doing research, and leaving. And that was not what the city needed. So even before the water crisis, we had tried to create the infrastructure. Academia had tried to create the infrastructure to work hand in hand with community. So any Michigan State University people here? Where's my Spartans? I know we're in a tough place, but yeah, go green. Okay, it's all good. We work together. MSU in the early 2010, 2011, recognizing kind of the disparities in Flint, the high rates of poverty, unemployment, every kind of health disparity you can think of, life expectancy disparity. A kid in Flint has a 20-year difference life expectancy between a Flint census tract and another census tract in the same county, 20 years. So this has been going on for a long time. And Michigan State University, a community-based medical school, has had a footprint in Flint for for over a century, listened to the people of Flint who wanted solutions. So they created this kind of community-driven public health program based in Flint. All of MSU's public health programming is in Flint, and it was co-created with the community. We asked the community, what do you want us to do here? What do you want us to work on? If we brought researchers, what do you want them to do? And by and large, the community identified those issues: behavioral health, healthy behaviors, chronic disease, and disparities. You can like fit anything in those buckets. But they also said, we don't want more observation research. We want people to come in to do translation, to actually try to improve disparities. So that's what we've been trying to do. We have built this public health enterprise, once again, humbly, hand in hand with our community partners. Our community partners are on search committees. They interview faculty. I have a director of community engagement on my team. Most of my staff are from the community. I have a parent partner group. I have a group of kids that advise me. They're amazing. They've named themselves the Flint Youth Justice League. And we get together now for like 6-7 years. I listen, which is really hard because I love talking, but I close my mouth and I listen. And I listen to what the kids and parents want us to do. So that is how you build trust, by listening, by kind of stepping out of our ivory towers and our institutions and our classrooms and humbly working with the impacted communities that we are privileged to serve. But it's a long road to build trust. And once again, trust didn't break overnight. Trust was kind of really corroded for a long time. And it's going to take a long time for academia to be that ethical partner to rebuild trust.
Thank you. And Luke, in your book, The Injustice of Place, which I highly recommend. I read it over all three books are really amazing. But my memory is that you or your colleagues like drove around the nation to meet with individuals, because as I recall, the thinking was that the type of poverty people were living in was not necessarily being picked up by surveys. And so you had to actually sit and talk with them. But in that scenario, you don't have the advantage of building trust over a long period of time. You're just meeting them immediately and trying to do a qualitative interview to hear what they really think. So do you have any advice or recommendations about that type of work?
Yeah, I do think it is about, in every type of work that you do, as much as there can be co-creation in that. So I think people really do want to tell their stories, but it has to be presented in a way of respect and in genuine interest. And when that happens, so with the road trip, we didn't do that. But as we got to know the 4 communities that we really write about in the book, we and our teams were there for months, and we came back over and over again. And really, that book was driven not by anything that we thought we were going to write about going in, but about the things that we heard. And now we're working on policies that, big and small, that will try to address that. So, I think often researchers, they come into a place and the first thing is like, I, the researcher, am interested in X, and I want to come in and do more around whatever it is that I'm interested in. I do liver biopsies, so that's what I'm going to do here. And I think the more that folks can take an approach of partnering with communities and sort of letting the research agenda be driven together, can work to rebuild trust. So I'll just give one example outside of the book. In the work with Poverty Solutions, we formed a partnership with Mayor Duggan and his team in the city of Detroit to partner on policy initiatives to promote mobility in the city. And when we formed that partnership, if I had written down the 100 things that I thought were most important to target in enhancing mobility, the cost of auto insurance wouldn't have been on that list. But it came up over and over and over again. And it turned out, we were able to go to the data and see that the same policy that costs like $1,000 nationally was costing out at close to $6,000 in the city of Detroit. That's like 20% of the annual income of Detroiters. And that the single best predictor of somebody's auto insurance is the percent of Black Michiganders that were in that census tract or that zip code. So this was a system that wasn't operating like it should. It wasn't on my radar. We wrote some research that was a part of getting to the 2019 reform, which has had some impact on rates and also generated some criticism, but definitely hasn't gone nearly far enough, but has brought down the average rate in Detroit by $1,000. So, not something on our radar, but in this co-creation that Mona's talking about, we try to show value to say we're actually listening and trying to do something on the things that you tell us, not just listening and then leaving.
If I can add one more thing too. So whenever we do research, we obviously go through our institutional IRBs, and we work with lots of partners. So sometimes there's reliance agreements with the hospital and other universities. But we have another entity in Flint that we go through, and it's called the CERB, the Community Ethics Research Board. So we have it's established by community. It's all community members that review research projects, and we don't have to go through this, but we do. We go almost every single project that we do. We also go through our Community Ethics Research Board to make sure that to get their input, to answer questions, to get their buy-in, to get that extra stamp of approval from community to build trust in our work.
Great. So there was a line in your book that it was referring to a child you were seeing in clinic and their experience of toxic stress. And the line, I think, was something to the effect of, this child had experienced so much toxic stress in the first years of his life that there wasn't enough time in a lifetime to repair it, something like that, which I thought was really moving. And in your book about the theme about cash, and that families don't have access to cash, and the history of that, and those needs. And so with that, I wanted to ask the two of you to talk a little bit about your collaboration together now, that you work together. How did that start, and what is the program that you are collaborating on now?
It's really weird that an MSU and a UM person would work together, right? So that and a pediatrician and a policy person. But it's been this awesome, incredible collaboration that has merged kind of science and medicine and policy. So I'm still a practicing pediatrician. I was in clinic on Monday, and the kids that I care for are struggling with so much, lots of toxicities, lots of adversities. Although, since the water crisis, we've really kind of doubled down and put into place so much evidence-based awesomeness, high quality childcare and expanded Medicaid and nutrition prescriptions and trauma-informed care and mental health services and literacy expansion, Reach Out and Read, Imagination Library. I mean, the list goes on of the really good stuff we've put into place to improve the health and development of our kids, to mitigate the impact of the water crisis, but really to mitigate the impact of these long-standing toxicities and adversities that, that implicate the life course of our children. And so when I'm in clinic, as I was on Monday, and I have a little baby in my arms, and I had this really cute 4-week-old in my arms on Monday for a well child visit, and we're throwing all this goodness at them, it's still frustrating to know that I don't have the ability to treat what is probably one of the most kind of toxic pathogens that my children face, and that's growing up in poverty. So we increasingly know the science of what happens when you grow up in poverty. Flint's the poorest city in our state. The child poverty numbers that were just released this last week, our numbers soared to about 70% child poverty rate. It's even worse for younger families, and it's chronic, and it's concentrated, and it's early in life, and that impacts your pathophysiology, and once again, impacts achievement and health and equity. So I was sick of Band-Aiding. I was sick of Band-Aiding the problems, the consequences of poverty. So I'm like, I'm gonna do a child allowance in Flint, but I don't know how to do a child allowance. So I emailed this guy. I'm like, this is a really famous guy in Michigan who's an expert on child poverty. I'm like, maybe he'll want to work with me. So I blindly emailed Professor Shaefer. I'm like, hey, I want to do something about child poverty. Will you help me? And he said,
I didn't know it yet, but I had pretty much just been waiting for Mona to email me. I was, of course, the days that we had the expanded child tax credit, the first day that those payments started to go out was the happiest day of my professional career. I think we all get into this because we want to be a part of positive change. And then the worst day was when it became clear that it was going away and that we had seen sort of what we could do, and we decided to go back in the other direction. So I'd been struggling to figure out what to do. We have all this evidence from all over the world that this works. We had it here in the United States. It wasn't going to be law of the land, but we had proven that it could work. And so, getting this email from Mona and thinking there was nothing that I would want to do more than being a part of bringing a child allowance to the city of Flint. And so I came up, we had lunch, we started running the numbers.
Didn't scare them away, you say?
And, we ran the numbers for all kids, and that was a lot of money. But then, hanging out with pediatricians, you start to learn how incredibly important.
Pediatricians are awesome, right? Yeah.
How incredibly important that first year of life is, right? Babies' brains double in size. So we decided to focus on this critical first year of life.
So RX Kids is an unconditional and universal cash allowance program that is starting in Flint in January. We are going to be prescribing every pregnant mom in mid-pregnancy a $1,500 cash allowance. And then once a baby is born, it is a $500 cash allowance a month for the first 12 months. This has never been done before in the country. There's been lots of small pilots, but never at this scale. This is universal and unconditional, and that to us sends a strong message that this is how we're supposed to care for each other as a society. This is us telling families that that they are loved, that they are seen, that they are heard, that there is a village walking alongside you during this very difficult time of being pregnant and having a child. So it turns out that this perinatal period, the period right before childbirth until the first year of life, is the most economically vulnerable period. That's when poverty spikes because moms lose income, babies are expensive, childcare policies here are terrible, so family leave, et cetera. So there's a dip in income, a spike in poverty right around that period, and it persists for the first year of life. And then as a pediatrician, as a scientist, we also know that that maternal infant period is so critical for child development. So that's why, as Luke said, this is kind of laser focused on this maternal infant period to address all the maternal infant health disparities, maternal morbidity, maternal mortality, prematurity, low birth weight, child development, maternal stress. So we're researching lots of different things, and we'll talk about that at the individual level. But also, since this is it's a community level intervention, and unlike many research projects, we think that people will sign up pretty quickly. We think we'll get to 100% saturation fairly quickly. We're also going to be able to look at community level markers, like what happens to population stability. Do people move into Flint because of this program? Wouldn't that be amazing? Where do those dollars go? $9 million a year will be cash allowances, which will largely flow back into the local economy. What is that jolt to the local economy going to do? We talked about kind of the rebuilding of the social contract. We're going to measure trust in government and trust in institutions. We're also going to measure things like civic engagement and voting, because I think this will actually help restore democracy in cities and communities across the nation that have really kind of lost their faith in government. So there's lots of research. We're going through our IRB processes right now.
Thank you.
Thank you. To be able to do this, but it's a lot of money to do this. We need $55 million to do this for 5 birth cohorts, so 5 years of moms and babies. In about 7 months, we have raised
$41 million.
$41 million. High five. Philanthropy has really stepped in, but so has government. So the state of Michigan and the budget that Governor Whitmer just signed included $16.5 million for RX kids. And that is coming from the Cash Assistance Program, TANF. And it is, it's really awesome because it is changing this program that has historically been racist and exclusionary and reactive to a system that is inclusive and dignified and preventative. So we are kind of this demonstration case. The state wants this to start in Flint, but hopefully after gathering evidence, we can quickly spread this across the state and really across the nation.
Great.
So we still need $15 million, okay?
So if you have rich friends,
rich friends. I mean, this is like legacy work. So, you know, if you know anybody who's interested, who's, you know, has a lot of money, flintrxkids.com.
So this is my last question before we're going to open it up. But so I wanted to ask you both about policy and how, in your experience, it works best to translate research into policy. And I wanted to comment first about, so in your book, near the end, it talks a lot about like in real time that you had these data and you were trying to present it to leadership in the government and they didn't believe your data. And I think they said like, some community pediatrician or something, they were very dismissive. And so I was hoping you could talk a little bit about now looking back, reflecting on that experience of like what you learned from it, or, you know, how is it most effective to try to get leaders to listen to your data. And then Luke, your book was just so fascinating to me because it was a historical perspective on how policy happens. And I think it was like within my own lifetime and like during periods of my training that I was in medical school and then training to be a pediatrician. And I admit like all that policy was like kind of noise in the background to me. Like I was living it in clinics, seeing kids in clinic and was not able to put together how what was happening in government was going to have repercussions for decades on these kids I was seeing in clinic. So I was hoping you both could comment a little bit on that and offer your insight.
So it's been said that pediatricians are the ultimate witnesses to failed social policies. It is in our clinics, in our exam rooms, that we see the consequences of often our inaction as a nation to take care of children. And that was clearly evident in Flint. That's clearly evident in terms of child poverty. We, you know, as Luke mentioned, we proved as a nation that we can fix this. We fixed this in 2021. We dropped child poverty, thanks to Luke and his colleagues, to the lowest level ever, to about 5%. That's amazing. We did it in a short period of time. So we can do hard things as a nation. We can care for each other. And then we didn't. So I think that is a reminder of our power to do really awesome things, but really how so much of this is driven by policy. So, you know, I did research. I did research that, and I shared that research publicly about what was going on in Flint at a press conference, which is not that's not how academics, that's not how we share research, but I couldn't wait to have it be peer reviewed. Like this had to be shared because every minute that went by was another kid was drinking water that was contaminated with lead. So I got up to share numbers and science and statistics and p-values. And I'm like, who can dispute can you imagine being in the middle of a public health crisis and not listening to science? It's a joke. It's a joke. Because we all just went through COVID, right? So like, I'm like, but I was naive. I'm like, I'm just sharing facts. I'm just sharing science. Like, and it wasn't even complicated research. Like I compared lead levels before the water switch to after the water switch. And I looked at geography, like it was only increasing within the water limits and where the water levels of lead were the highest, we saw the greatest increase in kids' lead levels. Like it was really kind of common sense research. It wasn't hard, like a two-tailed test. It wasn't hard. Okay, so I shared the science and I felt great. I'm like, yay, science, research. And as you said, like I was attacked. Me as a researcher was attacked. My science was attacked. The state said I was dicing numbers, that I was an unfortunate researcher, that I was causing near hysteria, which is my favorite because that's sexist. That word hysterical has been thrown against so many women over time. But it was a quick recognition that every number in my research, every single number was not a number on my spreadsheet on Excel or SPSS. It wasn't just a number. Every number represented a child. And that recognition allowed us to kind of push back and say, hey, our research is right. And finally read the book, but finally the state looked back at their numbers and said, yes, your research is not right. So looking back at that experience, I've learned several things that, it's really important to do good, solid research because I was attacked. And when you're attacked, it's hard not to second guess yourself. And there's like the sense of imposter syndrome, like, oh, maybe my numbers are wrong. Maybe my research is wrong. Maybe I'm not an expert. But my research was solid. It was done correctly. So it's important to do kind of ethical, sound research. But I also learned that we need more than numbers, that there's a power to stories. And I think, Luke and his books really share that really well. And I tried to include that in my book, that we as academics, as researchers, are often unable to sway the public and policymakers without storytelling. So the last time that I testified before Congress about the Infrastructure Act, which replaced lead pipes across the country, I didn't start with lead and the toxicity of lead and water, but I started with a story. I started with the story of a patient, and I held up a lead pipe that was from a patient's home, and I knew what happened to that patient, and I talked about that story. So we as academics, I think, need to be better storytellers to inform policy. And I think something that Luke knows more than I, that, policy change happens in windows. There's windows of opportunity of policy change. There's been people that have been trying to replace lead pipes, before I was born. But there was this moment in history where we made it possible because of our advocacy and because of our persistence and because we had developed this kind of breadth of science and evidence that had made it possible. So science is so important. Storytelling needs to be kind of hand in hand with it. And also the need to be kind of persistent in policymaking.
Thank you. Luke?
I just sort of hate to talk after that. I have to say, I was inspired. I don't know if you all were, but I guess the one thing I will add is whenever you sort of see a situation that is unequal, I think research more often than not sort of tends to start it's like we almost assume it appeared out of thin air, and none of what we deal with appeared out of thin air. Just as Mona mentioned, there's this acute crisis in Flint, but we're talking about generations of economic policy. We're talking about redlining. We're talking about racial segregation, school systems. It's a long history, and so when you're a pediatrician in your office, I know it's hard, and just when you're reviewing proposals, I think thinking about, are they doing any sort of historical analysis that sort of gets at some of the heart of why things are the way they are? Because I think that has to help shape our trajectory, right? We're not going to come to the right solutions if we're not attentive to exactly how we got where we are. And I do think policy changes, you have grand policy changes that can, have huge impact, and those come in windows. There's also, I think, every day something that a state administrator of a major department at the state or a city administrator, there's every day small policy things that people can do that will make things either better or worse for our most vulnerable, neighbors. And so I think in terms of, one very quick policy change that I'm proud of, I served as a special counselor for the Department of Health and Human Services here in the state of Michigan. And when I came in working with them on anti-poverty policy, if somebody lost their bridge card that had their SNAP benefits, the state of Michigan would charge them like $10 to get a new bridge card. So like you're on this program because you don't have any money. We're going to give you food assistance on the card because we don't do that much cash anymore. And if you lose the card, you have to pay us in money, right, to get another one. And so, you know, we in the department had said, you know what, we're not going to do that anymore. And actually by the legislation, we couldn't charge $0, but we now charge like 1 cent to get the card. And that is a cool thing. That's not the transformational policy, but there really are opportunities out there. And I think you can nudge research projects towards some of those.
I'm going to share one more research to policy because I know our NIH friends are here. So my pediatric clinic in Flint is atop a farmer's market. We moved there on purpose to address nutrition insecurity. So before we moved there, I used to tell my patients, like, eat avocados and kale, and they would just stare at me like, where am I going to get that? And like, how am I going to afford that? So we as an institution moved our clinic atop a farmer's market, and every kid that comes in gets a prescription printed on our electronic medical record for fruits and veggies that they can fill at the farmer's market. And through grants, it's now a $15 value. So they can fill at the farmer's market, or they can actually get a produce box delivered to their doorstep. So we've been doing this for a while, and I have public health nutritionists on my team, Ph.Ds, who have been researching it, and we've been supported by many grants, including a grant from the NIH, to research the kind of the efficacy of a nutrition prescription program as a prevention in a pediatric clinic. And what we've been able to find is, you know, improved behavior and knowledge, and even things like improved BMI of our patients that come in and get prescribed this nutrition prescription. So our U.S. Senator, Debbie Stabenow, who's very kind of prominent in agriculture and a big child health champion, came to our clinic, learned about our research. We sent her the publications. She met with some of the kids and the families. She heard the qualitative research where families said, like, my kid never had a fresh blueberry before this. All of our food was frozen. We could try different foods. You know, you don't give us a sucker when we leave. You give us fruits and vegetables. You care about us. So really great quantitative and qualitative research. And she was the co-author of the U.S. Farm Bill. And in the last round of the U.S. Farm Bill 5 years ago, she included a nutrition prescription program at $25 million a year. It passed. It was signed by the president. For the last couple of years, it has increased to a $40 million national program inspired by our research in Flint. So there is one example, and there's many, of research, good research, that has translated from practice into policy.
Thank you so much. So with that, I wanted to open it up to the audience. If anyone has any questions, you could raise your hand. Oh, I see. Is there someone? Oh yeah, there goes the microphone. And could you introduce yourself and where you're from?
Rebecca Hughes, University of Michigan, here, Ann Arbor. I just want to know more about your community leaders, and I don't know if the same people ended up being on your ethics board. A lot of the research I know that happened in Flint prior to that aimed at churches, and I just want to know if you had to do more to include people, to try to find people in all the pockets and make sure they were represented, and also how, as a community, you worked with them to make a beacon for the most important studies and maybe get them to avoid or, you know, make sure that the most important studies got to them so they weren't over recruited.
That's a great question. And I think something that we've learned in Flint, and something that's common in every community, is that community is not one voice, community is not one person, community is not one sector. So we have been kind of really committed to making sure that we have all voices of community. For so long, a lot of our researchers in Flint worked with the same community partners. And because they worked with them so much, they almost became academics. So I think it was really important. It's always really important for us to take a step back and engage other parts of the community. So on my team, I have on my leadership team a director of community engagement and implementation, a woman from Flint who has a seat at the table of every part of our decision making, programmatic research, what have you, that makes sure that we have good representation from the community. For example, our parent partner group that we have is parent advisory that informs our research and our work. We made sure that we had moms and dads and grandparents. We made sure that we had representation from every ward of the city. We made sure that it was kind of gender and racially representative. Same with kind of our kid advisories. So we always take a step back and we try to refresh. The RX Kids program that we're launching now, it's for moms and babies, right? It's awesome. But we wanted to make sure that we had a good representation of young moms. Our parent group had a lot of older kids. So we are refreshing our community partners continuously, as well as kind of making sure they're embedded in our work. It's not us asking community, it's community asking community. This work is being done by Flint, for Flint, with Flint. So it's not so much us and them, it's the us as part of us. So we've embedded community in the infrastructure of our operations.
Hello. Oh, sorry. I'm Michael Callahan. I'm with University of Michigan. Thank you both for the talk. I also was really happy and was hoping to hear maybe a little bit more that there was a discussion about narrative and the role that plays in policy work. I'm an attorney, so that spoke to me pretty directly. But part of the challenge, at least that I see, is sort of this very far removed outsider, is that the challenge of translating or telling a story that is scientifically accurate with data, but also coming across things that are really kind of ingrained in our narratives as a society. When Dr. Shaefer made a comment that his colleague said, well, this can never happen in the United States. It's like, well, yes, because we have the narratives of you just pull yourself up by the bootstraps, you choose to be poor, all these really toxic, regressive narratives, and are unfortunately, are deeply ingrained, but sadly also make for good stories. I mean, we have Horatio Alger, we have all these other things that are completely fictional and wrong and ultimately very bad, but unfortunately it's sometimes easier to get one of those pithy little comments to get more widely accepted than very sound scientific data. So I was wondering if you could speak a bit more and offer tips, thoughts, or ideas on translating results and research and how you reach that broader audience across not just the research community, but the public at large, who ultimately choose the leaders who are going to implement those policies.
Well, you're absolutely right. Whenever I introduce myself, when I say I study poverty in the United States, immediately I know people have thoughts, right? They have their own narratives because they're so deeply ingrained. I sometimes wonder what it would be like if I introduced myself and said I work on microchips or something, and people have no preconceived notions of that. And sometimes I can feel the preconceived notions actually in my head as I'm going through the data too. So, and in this most recent book, we can see how long these are. We could take quotes from the 1800s where people are saying, the poor are lazy, they're probably doing what they shouldn't be doing. We give out too much welfare, which was hilarious because there was no welfare. It's however much you give, Americans are pretty sure you should give less. But it is also true. One of the interesting pieces here is that human beings are complicated, not consistent little creatures, and there are other narratives too. So one set of work can be countering the narratives that we have. Another can be how do we reframe the narrative? Interestingly, if you ask general social survey. Anybody know the general? Yeah. If you ask Americans, should we give out more welfare? They really hate that idea. If you ask Americans, should we do more to help the poor? 60 or 70% say yes. And so I think that's something we can learn about and listen about. And that's part of what we did with the expanded child tax credit. So, we had an older program. And you want to talk about narrative too, like the signals that we would send with the welfare program, long applications, hugely invasive questions, administered in overtly racist ways. All of these, I think all of those signals really send a negative, they impact people in negative ways. That something like the expanded child tax credit starts with a different logic that I think it actually turns out most Americans agree with too, which is raising kids is expensive and society has a reason to come alongside parents in that work, and is remarkably more successful, even though the biggest impact is giving unrestricted money to poor families, right? So understanding the narratives, figuring out where do you want to counter them, and also how do you reframe them so that they're more positive for the families themselves and more popular in society. That's the work.
I'll just say that we are actively working to reframe the narrative for this RX Kids project. We're also leveraging arts and imagery and music and storytelling. Moms will upload selfies of their babies, which will be shared. We're going to have murals throughout the city. This is going to officially launch on Valentine's Day next year. So there's going to be love songs to Flint moms and babies. So really pivoting towards this is, once again, how we care for each other. And this is what society should be doing. Go ahead.
Is there a way average people can donate to to your project, the RX Kids?
FlintRxKids.com. FlintRxKids.com. You can donate.
You want to give $14 million,
Yes.
and we would be done.
We accept all donations, but once again, you must have a millionaire cousin somewhere.
Well, on that note, thank you so much. Join me in thanking Luke and Mona for being here today.